Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager and I am your host. I am a family nurse practitioner. I teach functional medicine, nutrition, and entrepreneurial skills to nurses and nurse practitioners. On today's episode, I wanted to talk to you some about getting your foot in the door as a functional nurse or functional nurse practitioner. Let's get started. I've been doing a lot of talking about nurses stepping into the entrepreneurial space and launching the Holistic Nursing Entrepreneur Program. I've been meeting a lot with many nurses that are on their own entrepreneurial journey. And meanwhile, I've been keeping in mind that that isn't for everybody. When I meet with my students that are in the Functional Medicine for Nurses course, we're talking about using this in all settings. I have never thought that all nurses should leave allopathic healthcare and start their own practice. I think that it is a great idea and that more of us need to do that to kind of fill in some of the gaps of where healthcare is lacking right now. Our patients are looking for something different. Nurses that are starting their practices are thriving because patients are looking for somebody to do that like root cause deep dive that we're able to offer, and spending time digging through their lab work, going over their health history. There's so much value in that. But at the same time, we need nurses to be asking why in every healthcare setting and really doing that functional medicine type approach in every setting wherever we work. I try to keep that in mind and balance the types of conversations that I have with nurses. And recently, over the last year or two, I've been thinking a lot more about nurses using groups and providing education for their patients. I have been interviewing a lot of experts and talking about these topics for the entrepreneur program. In a couple weeks, I have an interview to share with you from Practice Better about some of their offerings that support nurses in doing that. And when I was having that conversation with Natalie Mullen, that'll be available in a couple weeks for you here on the podcast, we were talking about all the different ways that we can use that platform to reach a wider audience. And a lot of that goes into running groups and memberships and providing education for our patients that they can access at any time. We can do that in like so many settings. And I think that nurses get in the frame of mind of like that we're going to go punch a time card, work in a hospital or long-term care facility or in a clinic and leave and exchange our time for an hourly wage. And the places that we're working in, especially in allopathic setting, they're struggling, right? Their patient outcomes are not improving the way that they would be if we took a functional approach more. Providers are strained for time with patients, want more education, and they need more education to improve their health outcomes. And meanwhile, if a nurse is just coming in and doing their exchange for their hourly wage, doing the role that has been in existence for, hundreds of years, essentially now at this point, of going in, doing tasks, completing a role and leaving, there is room for us to advocate for something different in the settings where we already work or in settings in our community that need better support for their patients. That's really what I wanted to talk about today. I have a lot of nurses that learn functional nursing skills and holistic nursing skills, and they want to share that with a bigger audience of patients. They want to maybe leave a healthcare setting that they're not happy in, maybe try to approach a functional medicine clinic in their community or an integrative medicine clinic in their community and advocate for a role there or apply for a role there. A lot of nurses ask me, like, how do you get your foot in the door? How do you start those conversations? How can I advocate for a role in a setting like that? I thought we could talk some about that in this episode. When I first started thinking about using a functional medicine type approach with my patients, I really was limited in only seeing how I could make a difference as a PCP or like in that one-on-one encounter with patients in my office. When I got into that role, I realized that the time constraints were like a big factor for me not being able to offer the care that I wanted. We had a nurse in our clinic and they didn't have a functional approach. This was in a totally allopathic setting, but I got really comfortable with the idea of an RN doing a lot of things in a clinic setting that are in their scope. And I think that our clinic was pretty innovative in using an RN to a higher licensure, stepping more fully into their scope than a lot of other settings. We had previously had like medical assistants or LPNs that were sometimes filling that type of role in a clinic. And leadership decided to try out having a registered nurse fill that role in our clinics. And it really was wonderful because they were able to bill for a lot of their visits. They were able to do like one-on-one visits with patients and provide education, do a lot of triaging and things over the phone or in person with people. There were a lot of things that an RN could do that a different type of role in the clinic maybe wasn't able to because of the limited scope. I think just in a general like primary care setting, there's a lot of room to advocate for an RN taking some of the time away from the physicians and nurse practitioners that are trying to see as many patients as possible. It can really be a great way to have a blend there to support the patients better. I feel like I kind of early on in my functional medicine career into nursing, I was really thinking about how to use nurses in a clinic setting to support patients better. And I wanted to kind of like talk about how we can do that in a more broad way and how nurses can advocate for this. Nurses already have this skill set foundationally before they even learn functional medicine of patient education and health promotion and care planning and functional and integrative practices, we know need nurses. They need them more than they realize. The things that I feel like are in the way of functional medicine and integrative care reaching more people tends to be two factors. It's inaccessible because of the amount of time that it takes to do a deep dive with patients and to provide the type of education around their health concerns to create some awareness and help motivate change, and finances. When providers say, okay, I want to spend more time with people, I'm going to have my own practice, I'm going to charge cash, I don't want insurance dictating the type of care I deliver. Now you have this being something that is not affordable, it is not covered by insurance, it's less accessible to a lot of patients. And I think that integrating nurses more into these practices can relieve both of those big factors. In the past, I think since the dawn of functional medicine, the solution has seemed to be, and for years, conferences I would go to on functional medicine topics and listening to experts speak, the big solution was to bring in health coaches. Because I am a nurse coach and I have a background there, board certified in that, and I teach a lot of nurse coaches. I tend to now always ask people when I have an encounter with them, do you know what a nurse coach is? Are you aware how they could like fit in a practice? And still, there is not a ton of awareness around it in the functional space. I want to encourage all of you to make sure people know what nurse coaches are. And especially if you're a nurse coach, I think that people are not making the connection that it could really be something to help support practices better. The movement in the past has been hire a health coach. And I have looked into how much health coaches are getting paid to support patients in a clinic and take some of that strain off of the providers and provide education and coaching. These are people with maybe a high school diploma and like a course online that they've taken. This is not a nursing professional with healthcare licensure and, you know, a college degree or many college degrees and years of training and skill. They are getting paid as much as nurses are. And that's not okay. I think that nurses should be filling that role. Nurses are the perfect people to be coaching patients and stepping into these clinics and supporting the entire process. But I just feel like nurses need to create some awareness around that. We need to have these conversations. Like I try to limit my social media now, but when I schedule most of the things that you see on there, but when I'm on there and I see somebody talking about, I might bring a health coach on in my clinic. What does that look like for you? How much do you pay them? I do try to jump on there and comment and say, have you ever heard of nurse coaching? Are you aware that nurses can coach patients and you can also use them in your practice in many other ways? I encourage all of you to do that too, even if it's not for yourself, just to support this as an endeavor moving forward so that more and more people are aware that they could be using an RN in their practice to support their patients better and maybe choose that over a health coach. That's kind of the take home message today. I encourage you to not wait until you find a functional nursing job post. I don't think that that is something that you're going to see a lot of for a few more years. I think we're the people that should create the awareness that this is what would support these practices to take care of patients better, reach more patients, take the burden away from the prescribing providers and their one on one visits. I encourage you to advocate for a role in the setting that you already work in a setting that you want to work in. And one thing that I hear a lot from nurses is that they have reached out to clinics in their area, either to connect with them, to seek employment, or to seek like a preceptorship or see if they could shadow somebody in the clinic, and they don't hear back. I want you to reframe that from like they're not interested to most of these clinics that are established and practicing functional medicine or integrative medicine are booked out months and months. And I bet if you call, you will find that that's the case. Maybe they're not even taking new patients right now. The people that don't have time to answer you are the perfect people for you to try to work with because they're the ones that could definitely benefit from some help and they could get more people in to work with if that time burden was relieved for them a little bit. I encourage you to reframe that a little bit. Nurses can step into these clinics and become patient education specialists for those providers, especially in clinics where they're seeing patients with a particular theme, like perinatal care or maybe a GI clinic, cardiology, endocrinology, women's health. You could be running patient education groups, or you could be running group medical visits for people with a similar diagnosis, providing a ton of education for these patients. That would relieve the provider from having to have the same conversations with patients all day long. One that I always think of is like walking patients through an elimination diet. Maybe every new patient that comes into a functional medicine clinic is probably going to be put through an elimination diet unless they've done one recently. Provider explaining that and supporting a patient through it is really challenging and a big strain on their time. Or the patient goes home with a ton of questions and they're writing in and asking all these questions and needing clarification on things. A registered nurse running groups that are kind of like a revolving door of every other Thursday or whatever works for that clinic. We have our registered nurse running a group on this. It could be in person, after clinic hours, during clinic hours. It could be online. Some of it, if it's education, could be pre-recorded. You could create content and offer it as a service. There are so many ways that we can deliver this information that patients need in a more efficient way than having one-on-one conversations with the most overextended person in the office being the one that's delivering the education when an RN is the perfect person to be doing this. We have more of a background in education than many other types of providers do, and in in educating patients, in taking that holistic approach, finding out what the challenges are for patients and meeting them there, finding out what their goals are and helping them move the needle on that. You may or may not be aware of the idea of group medical visits, but even the most allopathic of healthcare settings are now becoming aware that there is greater reimbursement in doing group medical visits, which they really care about too when they find that out. Group medical visits are billable through insurance. Each patient that attends that group medical visit could be billed through their insurance for the visit. We know from lots of studies now that patients do better when they are seen in a group setting with other patients with a similar concern or diagnosis. The majority of that group dynamic can be led by an RN. A really typical model that can be really efficient is to have somebody like a medical assistant bringing in each patient that's coming in for the group medical visit. They're doing their vital signs and documenting those in a template. And then the nurse is going to provide the majority of the facilitation. That is going to include maybe some education. It could include the patients getting some opportunities to share with each other. And I think that's one of the biggest benefits of groups is them really interacting with each other and having some camaraderie there. And then the provider would need to have a brief encounter with the patients look over their vitals. Maybe there is one or two patients that, they're there for a hypertension group and their blood pressure is kind of out of control and they need their medication adjusted. They could pop over for a quick adjustment or get scheduled to segue into an adjustment of their medication. But the majority of people can be seen in that group setting and really benefit from it. Meanwhile, instead of seeing one patient in that hour or four patients in that hour, the provider is able to maybe still be seeing other patients during this time and participate to some degree, a much smaller degree in the group setting. But all of the patients that have attended that group setting for the day should be able to be billed through insurance, and it reimburses quite well. The patients have insurance covering this really holistic approach. The provider's time is improved. They're not as strained to provide this education one on one with each of these patients. The patient's outcomes are better. And we know that. There are so many reasons that the group medical visit is a great way for a nurse to support patients better. It's something that you can advocate for in your current setting or in other settings in your community that you feel are in need. And now, a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. This could be great for like gut health programs, chronic illness management like hypertension or type 2 diabetes, balancing hormones, fertility clinics. It is an endless option. Every time I talk to a nurse about their niche, I'm like, oh gosh, I can think of like 5 courses that you could teach or 5 groups that you could run. I think that at the moment, functional medicine has just been trying for years to use health coaches for this model, and it hasn't been particularly effective in most cases. There is something missing there, and it is the years of experience and training and the licensed healthcare provider approach that comes from our nursing background. I encourage you to lean into that and promote that when you have these conversations. Nurses bring not just their licensure and their clinical experience, but our ethics. We are the most trusted profession. We are taught to have that holistic approach in our brains from our first days in nursing school. And that really can be a big part of this being effective for patients. Nurses can also do a lot more in the practice. As I mentioned, they can triage patients. They can run their own nurse visits. We definitely did that in our clinic and were able to bill insurance for many visits. They can run these groups and offer patient education. They could also do staff education. In clinics I've worked in, we have RNs in leadership roles as well. So they're handling a lot of running of the staff and guiding them and mentoring them. And they can even do the majority of the ever popular Medicare annual wellness visits. If you're not familiar with this, corporate healthcare settings love these because they reimburse really well and they meet a lot of the boxes that they need to check off every year for patients that are insured through Medicare. How do we approach these practices and get noticed and get somebody to answer us? I mentioned a lot of my students have told me that they've reached out to functional medicine clinics, integrative wellness centers, and concierge medical practices in their area. I will even add, because I don't think enough people are considering this, specialty practices. In particular, I'm always thinking like GI and cardiology, but also things like endocrinology and women's health. Any clinic that might be interested in a root cause approach. Sometimes we don't want to say functional medicine or functional nursing, and it's better for us to just lean into being an integrative or holistic nurse that offers group models and education. I think that you have to use some savvy when deciding how to present this to a particular practice. If they're super allopathic, maybe using the term functional isn't ideal. But I encourage you to draft a letter or an email introducing yourself as a functional nurse or an integrative nurse. I would not simply state I'm an RN or an NP, whatever your scope is. I would share your skill set and your training and tell them what that means. A lot of people I think have stereotypes around functional medicine and functional nursing, letting them know that your background is very evidence based and whatever it is that you really focus on, most of us, that's going to be around eating a whole foods organic diet, improving people's food choices, their lifestyle choices, their stress and sleep, self-care. Really be specific about that so that providers can understand really what you would be offering for patients. And in particular, if it's an allopathic setting, kind of clarifying that it isn't too like woo-woo for them. Where if you're approaching an integrative or functional medicine practice, then I think leaning into that might be your better move. I encourage you in doing that. I will say, when I hear nurses that are calling, that's a burden on their time and kind of putting a timestamp up on, like, I want to talk right now. I think that sending a letter, sending it to every provider in that office, it's not just one and they aren't interested and it's over. It should go to the front desk. It should go to everybody in the office. You could call and ask if there is an office manager that it would be best to address letters that are applying to the whole office. That letter goes to everybody in that office. Let them know what you do. Let them know your ideas. Just trying to connect, asking for an opportunity to come in and say hello, but also offer to pilot maybe a group program or patient education series or something that I think a lot of nurses and nurse practitioners have been leaning into is like a functional health like intake process where they're the ones onboarding the patients and getting them in the practice and all set up before they ever even go to work with the physician or the lead, like the nurse practitioner that's going to be overseeing their care. You could propose services that are going to fill gaps that they are already struggling with. If you have a background in this setting, like you've worked in a GI clinic or you have worked with these like cardiology clinic, you know what those patients are talking about in their visits. You know what their concerns are. You know what they need their education around. You can propose filling in a lot of these gaps that are straining providers. And in this approach, let them know what the benefit would be for them, the trade off, and what you're envisioning that doing to benefit their practice. You can emphasize using scope of practice language. You can say, as a registered nurse or as a nurse practitioner, I offer lifestyle based nursing consultations. They're aligned with the nursing process and with my licensure. I think that really letting them know that you're not trying to overstep, you're not trying to practice outside your scope, you're not there to replace anybody, you're there to support their practice, and you have some great ideas of how to do that in a way that will make them able to reach more patients and spend more time with their patients doing things that aren't as repetitive as providing the all same education all day long. In doing this and pricing your services, I talk to a lot of nurses about the idea as an entrepreneur of how much to charge. It is something that most nurses struggle with. I can't give you a number for what to charge, but I will say please don't undersell yourself. Please be aware that there's a ton of value in offering these types of services. Please don't price your services too low. Some kind of thinking outside the box ideas that I have, subcontracting opportunities. You could start your own practice that specifically is offering services that are not like full-time employment somewhere. Maybe you go to every GI clinic in your driving distance and offer running gut health programs and programs on getting off of PPIs and addressing heartburn better for patients. Maybe you offer them, you have like 4 courses that you would run patients through as a program or as group medical visits that are things that those providers are talking about all day long. And maybe you set that up as a model for your practice and you offer it at 4 different GI clinics, and that is your business. That is one idea that I have had that I think more nurses could do, is to offer group visits. They become the expert in running groups, and then you offer it at various clinics. This could be something that they pay you a flat fee for coming in and running the visits. They could take you on as an employee to pay you to do that, but I encourage you to get paid well for your visit. In particular, if they're going to be billing through insurance, they could give you a flat fee for your time there, and then they could bill their patients through insurance. Patients could also like sign up for things that you're offering like after hours in the clinic. They could sign up using a QR code or your website information at the front desk, or there could be something up in the exam rooms to encourage them to sign up. If you wanted to make this your own business, there are still ways for you to get into a practice and support patients or several practices with maybe similar themed groups that you offer. You could launch your own functional nurse coaching business. I have many students in the holistic nursing entrepreneur program that's exactly what they're doing. And more of them are like, wait a minute, light bulb has gone off for me. I can still do my one on one visits with my clients I'm seeing now. And I can take what I know and share it in local clinics or run groups or run something in my community. There are a lot of ways that we can use this to reach patients. You could also partner with other types of services that sort of align with yours, like yoga studios, fitness centers, or chiropractors, acupuncturists, dietitians, folks that are similarly aligned. Maybe you have the same patient population. One that has come up a lot with me lately is some of my founding nurses in the entrepreneur program have backgrounds in perinatal care. You have all your doulas, midwives, lactation consultants, the OBGYNs. There are so many people that are touch points with these patients that are not offering the same thing that a functional nurse would offer or a nurse coach. That's something to think about too, is who else is seeing your patients regularly that you could connect with and maybe partner or offer your services through their facility. Some common fears I hear around this is a really big one, I'm not qualified enough. We have been nurses for a lot longer than the day that we start our business or start advocating for this type of change in our healthcare setting or new settings. I encourage nurses, even when they speak about how they care for patients or how they want to care for patients. One thing that I always try to remind nurses is like, the first day that you run a gut health clinic of your own, maybe you offer functional nurse coaching around gut health. The first day that you do that is not the first day that you have taken care of someone with gut health concerns. It is completely okay for you to say, when I have supported patients with gut health concerns, XYZ. We really undervalue the fact that we've been doing most of this for years, and maybe we have added to our toolkit recently. We're approaching things differently. Maybe we are a little bit more holistic, have some new information we can share, but this is not our first day as a nurse. And patients benefit. I have been doing this long enough to know for sure that patients are benefiting from working with functional nurses and functional nurse coaches and nurse practitioners. We are very qualified to do this. And things that might sound really obvious or simple to you are not obvious and simple to the patients. And they need somebody in healthcare to make these connections for them, to listen to them, and we're the perfect people to do that. You are absolutely qualified enough if you are a functional nurse or a functional nurse practitioner. Most of us could get up and talk about the thing that we care about the most for an hour. Maybe we don't want to do it in front of other people, but we could easily, and we probably have, talked about topics that we care about for over an hour without prepping. I promise you, if you are a functional nurse or a functional nurse practitioner, you could absolutely run a group visit for an hour. And group visits are not about us talking the whole time. I'm creating a course on running groups and a lot of these topics for my upcoming programs. And there is not a lack of us being able to talk about the topic. That's one big thing. Getting up in front of groups, that is a skill that we work on developing. Our group settings are not places for us to talk at people for an hour. Just like when we're nurse coaching, we are wanting to create awareness, ask the right questions. And in a group setting, that is really valuable because we can get people to engage in sharing their experiences and their insights, what's worked for them and what hasn't, and benefit from the other group members in that way as well. And another thing that I hear a lot is like, what if no one wants to hire a nurse for this? And I think that the system is behind right now. And I think that we're ahead by thinking about these ideas. Nobody else has thought of how we could be used yet. I think we really need to get out there and create that awareness, even in settings where you're not going to be the right fit or you're not even trying to get a job. Educating the people around you in your setting, in other people that you encounter about the value of using nurses in this way is going to move the needle in healthcare and improve our healthcare system by creating awareness around ways to use nurses more efficiently to improve patient outcomes. I encourage you, if you were going to maybe take this to the next step and get started, something for you to consider doing in the next 30 days. Find 3 practices that are aligning with your vision for what you could offer. If you're not just planning to do this in the setting that you're currently at, if it is your own setting, draft kind of a dialogue of the conversation you're going to have with the right person at your setting or how you're going to propose this. If you're going to reach out to 3 clinics, for example, draft an outreach email or letter that you're going to mail. Come up with the language that will convey the benefits that you could bring to the practice, what types of services you have in mind, what it could improve for the patients, and how it could improve things for the providers and reduce some of the burden on them as well. Brainstorm maybe 2 to 3 service ideas that you could offer. And then if you have any in particular that are really exciting, I think brainstorm those with some of your nurse friends and get somebody to look that over, and then go for it and share it with some potential clinics that you want to reach out with or where you're already at. I hope that this has been maybe an inspiring episode for you. I feel like the future of healthcare is kind of in our hands. Nurses are not waiting for permission anymore. We really are leading the change. This happens with each conversation that we have, each patient that we approach from the functional perspective, and each practice that we help shift in the way that they care for patients and shift away from this one-on-one provider-patient encounter to a new, more comprehensive and holistic approach for each patient. Until next time, everybody, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.